CCFMG is a multi-specialty physician group, and it's a huge group of hundreds of physicians within the Central Valley. And it encompasses all different specialties: surgery, medicine, OBGYN, and within those specialties, even more subspecialties.
With the growth of CCFMG as an organization, we've become the largest multi-specialty group in all of Central California.
We have all the services you need, from neurosurgery, pulmonary critical care, from infectious disease, everything you need.
That was not the case many years ago. Having this unique opportunity and partnership with CCFMG and UCSF Fresno has allowed us to recruit very qualified subspecialists to our area.
The physicians here, they do what's right, and that's why I'm so proud of them.
In looking back at the origin of the organization, Steve Parks so completely embodied what you look for in a physician: knowledgeable, skilled, compassionate, hard worker, and I think that trademark has carried through.
My father was a surgeon here in Fresno. He actually was one of the founders of CCFMG. You know, he was always very passionate about the Central Valley and about healthcare and about training physicians and having, top quality healthcare here in Fresno. And I think that sort of passion and that sort of fire just sort of it set the stage, and it sort of set the bar for this is what we do.
So today, from 40 physicians, we're up to 230. The organization has just under 700 employees with about 115 allied professionals like PAs, midwives, nurse practitioners, and the rest is administrative staff.
I think that we have been demonstrating what the needs are and solutions to those needs for 40 years. I think that going forward, we'll continue to push excellent clinical care. We'll continue to push expanding the educational programs to serve the needs of the growing valley.
As the community population grows and as the outlying smaller communities grow, I think we're continuing to look at opportunities to expand the organization to provide care for people throughout the neighboring geographical areas.
Fresno and this program are both small enough that you can actually make a difference within it. And it's big enough that it matters.
One of the remarkable things about CCFMG is the number of avenues as a physician that you can pursue to deliver care.
CCFMG is a great medium because it gives me that flexibility of balancing this clinical work that I really love with sort of this academic and administrative projects. And that's a really hard thing to do at some places.
CCFMG is a multi-specialty physician faculty group. When I say faculty, that's because we are UCSF faculty and we're training the next generation of physicians.
We really have a unique situation here in Fresno because we're CCFMG. We are a group of community physicians, but at the same time, most of us, if not all of us, are core faculty at UCSF.
UCSF is arguably one of the 5 best medical schools maybe in the world. What it allows us to do for the region is to attract a really high quality physician who is committed to quality education as well as providing high quality care for the region. So the two go hand in hand.
We promote excellence, camaraderie, and creativity. It's kind of what academicians do, and we take pride in kind of having our trainees imbibe that culture, because our mission is not just to manufacture clinicians. We want to train physicians who are future clinical leaders that can make a change in how the next generation sees the field of medicine.
It is our responsibility to train the future physicians. Someone has to be responsible for it, and we take it to heart. It's fun, it's challenging.
One of the things that I tell trainees when I'm working with them is I'll try and teach them as much as I can, and their job is to teach me something. And they never fail to do that.
being a part of that, I think, is really important, and getting residents and medical students and trainees involved in care within the Central Valley, I think perpetuates that same feeling that I had when I came here as a resident.
We are a resource for state-of-the-art medical care and also cutting-edge clinical research, medical research, and also some of the top training programs for young doctors.
CCFMG operates throughout the Fresno and the surrounding communities, and we're considered a University Center of Excellence.
The University Centers of Excellence are a group of offices, private offices, that are run by CCFMG physicians who, again, have the academic appointment. They are our private part of our business. They are the private part of our office. We have a vast array of subspecialty care that is available for us to refer to within our system. We have one electronic system. Everybody can see our notes. Everybody can see our testing. There's great lines of communication, and I think it really gives the patients an advantage where they get comprehensive medical care at one institution with a group of highly specialized physicians who are passionate about medical education, which ultimately leads to a very, very passionate physician who is motivated and educated to do their best.
This is why we are here. We love doing what we do. We are a strong group of clinicians, and we are good at what we deliver.
It's definitely very unique, and I think the need for experts and different providers can make a big difference in the Central Valley in general.
We have underserved population, young, appreciative, diverse population who are in need for medical care.
Fresno's not really known on the map. UCSF affiliation gets people's attention, and then if they've got research or they're really specialized, once they come to visit and speak to the folks, they realize this is a great place to be. Actually, a lot of our trainees stay for that reason. They probably never thought they would, but they get here, and after a 3, 4, or 5 year, depending on your training path, they kind of settle in.
Everybody is really here for the right reason. And I think that part of it, what you're seeing too, is the rewards of caring for a patient population that so desperately needs what we do. And that's honestly why we go into medicine to begin with, is to feel good at the end of the day that you've done things to help people.
We're here because we want to be here. We want to educate. We want to strive to be the best. So you will find physicians who are passionate about what they do and strive to be their best on an everyday basis.
In our department, I believe we have 7 female trauma critical care surgeons out of our 12 surgeons. So just over half of our surgeons are women. Although it's becoming more common, it's uncommon to have over half of the trauma surgeons be female. It's fun, it's a great group, and we show the medical students and the undergraduate students rotating with us that there are all different people can be a surgeon.
At CCFMG, we have a motto that we make education happen. We help with education not just of the residents in the training program itself, but also outreach to outside communities, to high schools that have programs trying to get young people interested in going into medicine as a field. All of that is, I think, stimulating, apart from the fact that taking care of patients is, of course, a very gratifying experience. And I think it's gratifying in ways that it's hard to explain to people who have never had the experience.
I think patient care is not just about giving medicines or treating their symptoms. We kind of establish a relationship with our patients, and if we can make a difference in how they live their life and somehow being able to enjoy each day more than what they otherwise do, I think that's what medicine is all about.
I think I would want the residents of the Central Valley to know we're here for you. We're here for you in whatever capacity you need us to be. We're here to help.
I'm Dr. Vipul Jain. I'm a CCFMG physician.
My name is Dr. Parks, and I'm a CCFMG physician.
My name is Jim Davis.
Dr. O'Banion.
Dr. Christian Falkenberry.
Dr. Fayed.
Dr. Teresa Daniele.
Dr. Iyad Al-Masri.
I'm a CCFMG physician.
I am a CCFMG physician.